Good day, everyone. My name is Dr. Pierre Corey of the Frontline COVID-19 Critical Care Alliance, and I want to thank everyone for joining us today for our panel discussion on the WHO and the Public Health Organization's denial of ivermectin. We're calling that Standing Up for Human Rights in COVID Care. And I'm joined today by a distinguished panel, and I'm just going to briefly introduce those who've joined us. So we have Jean-Charles Tessèdre from the organization Bon Sens, which is a French organization. Translation would be Common Sense Organization. We also have Jackie Stone from the Zimbabwe COVID-19 Frontline Clinician Society, as well as Ralph Larigo. He's an attorney in New York State who's been very active in legal action surrounding ivermectin. And then we have Baron Ois from AfriForum. And then we also have Congressman Mike DeSpencer from the Philippines. He's a congressman, and he'll be joining us as well. So before we get into the panel, I do want to mention a few things, some logistics. So right now we are live on YouTube. We also will be on that channel monitoring the feed for questions. So if you have any questions, please feel free to enter it into the chat on that live YouTube link. We also have media joining us as well. And so at the end of our discussion, maybe about 45 minutes in, we'll be going over to questions from the media and as well as anyone watching. And then what we'll do today is we'll do a panel discussion. And so we'll go around with questions from the panelists. If you've heard, they're joined to us all over the world. We're kind of united in a common cause. And you know, before we go to the panelists, I just want to sort of state the problem and why we're here today. And the problem is that we are trying to battle a pandemic while working within a system that's not working for us. And one of the issues that we have highlighted is that, you know, this is more than just about ivermectin. This is about a system in which therapies are being really restricted and deprived to patients around the world. And the selection process in the therapies that are being used, there's not really a credible consistency to how it's done. And what's obvious is that it's really a system in which the therapies that are being sort of pushed or promoted to the patients seem to be those that really have significant financial interest. Medicines that don't, even with significant amounts of evidence, are dismissed. There seems to be this artificial reliance on these very large randomized controlled trials, which overtly favor only drugs that can pass through those trials, which are generally pharmaceutical funded. And so we're stuck really battling a pandemic with almost sole reliance on novel pharmaceutically engineered products. And the global health is suffering. And like I said, that's not relevant to just ivermectin. It's relevant to lots of other different therapies that are not being provided to our patients. And so what I will say, though, is ivermectin is probably the most glaring. It's the most absurd example of a system that is completely dysfunctional and failing. And the reason why it's so absurd is that I've never heard of a medicine sitting on a bigger or stronger evidence base than ivermectin, yet all of the public health agencies around the world, mostly Western, let's say not all, right? But the big Western and international ones continue to dismiss its efficacy. And so the system's broken, and we need to come together and try to figure out how we can correct that and really save patients and promote global public health. So with that, I'm going to ask the panelists. I'm going to start out with a general question. We're going to go around. So if you guys could briefly answer the following. So first of all, introduce yourself, your organization, and really tell us what you have been fighting, you know, what your organization's been doing, what you see as the problem, and what you have done so far. And again, that's just a brief summary because we'll get more into that as we go. So why don't I start with Jean-Charles Tessèdre? Can you introduce yourself and your organization and what you've been doing?
So I'm a French lawyer. I'm based in Montpellier, which is a French city in the south of France. And I'm a lawyer since 20 years ago. I'm the lawyer of an organization, which called, as you said, Bon Sens. And it is a citizenship organization. but I'm also the lawyer of doctors. I bring an action for 500 doctors and some patients too, in favor of ivermectin. I try since October 2020 to obtain a recommendation for ivermectin in France.
Mm.
And that's what I try to do. I'm not a public health specialist in the beginning. I first develop an interest, a passionate interest for this subject, this matter, this case. And we have in France the Professor Raoult, and you necessarily heard about him.
Sure.
Because he's his protocol is the hydroxychloroquine with azithromycin, and he's very famous in France. And I think that his philosophy is a good one. It is your philosophy too, I think.
Yes.
It's early treatment. And I think I'm convinced that ivermectin is the best, as far as we know, the best medicine, the best drug today to care as an early treatment COVID-19.
And Jean-Charles, obviously France is one of the countries similar to the US where it's being blocked, not being recommended, correct?
Yeah,
we'll talk. I'm sorry, and then we'll talk. We're going to ask you more in detail about what you're doing about that, because we want to hear about the legal actions and your approach. Because I think everyone on the panel has a little bit different approaches and capabilities in what they can do. So
okay.
I'm just going to move on, and I'm going to ask Dr. Jackie Stone from the Zimbabwe COVID-19 Frontline Clinicians Society. So Jackie, again, can you introduce yourself, your organization, and what your experience is, what you fought for? And I would say that it sounds like you guys have succeeded, but could you tell us a little bit more about that?
Yeah, sure. So my name is Dr. Jackie Stone. I'm a family medicine physician, but my background has always been in infectious disease and a lot of aviation medicine, which is travel, vaccination, that kind of thing. And also, obviously, you've got to have a decent knowledge of hypoxia in the aviation medicine world. So basically, the Zimbabwe COVID Frontline Clinicians Society was actually formed at a time when ivermectin was clamped down on in Zimbabwe. So we, as the frontline clinicians, didn't have any hospitals to admit into from February, which we saw when we saw our first suspected case, all the way through to August the 15th. So we were managing patients in their homes, in our surgeries, in their cars, and we used what was in the pantry, and ivermectin was one of those things. And when we introduced ivermectin on the 8th of August last year, we just had this dramatic reduction in mortality. And in actual fact, our figures at the moment are our mortality is 1/10 of the state hospital, and we manage some very sick patients in the community. There was a move to stop ivermectin in January, and the frontline clinicians wrote to our Minister of Health, actually to the Permanent Secretary of Health, requesting that we continue ivermectin, otherwise we would be facing large numbers of deaths. And fortunately, we were permitted to continue using it. And I think the quote from our Ministry of Health is something that possibly the regulators all over the world could use. And I'll actually read it out to you. And I'd like to actually thank our Ministry of Health for their constant support and their vision. They said, in these difficult times of COVID-19 treatment, we have to be careful to protect the patients, which I think the regulators see as their role. And then they followed it with, as well as not deny them effective treatment regimes. And I think the regulators, so what we fought for, and we did win, although issues keep coming up because there are still those violently opposed to ivermectin, especially those who stand to benefit from COVID continuing and making a lot of money out of testing and making a lot of money out of admissions. And also the fear factor drives vaccination. So we still have the ivermectin antagonists, I suppose you would call them. But, you know, we really fought for the fact that our patients should be allowed to at least have the option of using a therapy that is safe, effective, affordable, and available in our country.
Dr. Snow, can you just tell me briefly, what is the status of ivermectin right now? Is it officially recommended in national treatment guidelines? It's allowable, it's permissible? How is it being used broadly or fragmented?
The whole country's on it.
Okay, there you go. So, and it's in the national guideline.
Not yet. we fast tracked a retrospective study, which I think I've shown some of the data from.
Yep.
We're waiting for that to go through Medical Research Council of Zimbabwe. As soon as that happens, the Permanent Secretary of Health, sorry, inhaling coffee is not clever. The Permanent Secretary of Health is going to hopefully approve it, and it will go into the national guidelines. It is currently one of the it's used in combination with a number of other things. So in the Zimbabwe College of Primary Care Physicians, it is in our guidelines.
Great.
But it's not in the hospital guidelines yet. And we are actually actively keeping patients out of hospital because the physicians stop it.
Well, I thank you for your efforts and the success. And yeah, we're going to talk more about that. So next, I'm going to ask Attorney Ralph Larigo. Mr. Larigo, could you tell us again what your experience has been around ivermectin and what you're doing to try to fight for that medication?
Well, first of all, I'm an attorney now for 47 years. So I have a law firm outside of Buffalo, New York. And on January 7th, I got a call from a client that his mother-in-law, 80 years old, was rushed to a hospital with COVID. She was placed in ICU and placed on a ventilator. She was given 20% chance of living. And if she lived, she'd be on that ventilator for a month. Her son comes up from Georgia. He's done his research. He's looked at Dr. Corey when you testified in front of the US Senate in December of 20. He showed me that video. I saw how passionate you were. He showed me a number of the studies from the Frontline COVID Alliance. And he convinced me that ivermectin was what he wanted for his mother. Now, when he came up, he convinced the ICU doctor to give her the ivermectin. She took the ivermectin, and within 48 hours, she was off the ventilator, out of ICU, onto the COVID floor. She was doing well at the beginning and then started to decline. The COVID floor doctors refused to continue the medication. So he contacted me. He came in on a Thursday afternoon. We spent till 11:30 that night preparing papers to litigate against the hospital. And by noon the next day, I had a signed order to show cause with an order from Judge Henry Nowak to obligate the hospital to provide the ivermectin. Now, when we served this upon the hospital, they fought back hard. We had to have a number of other discussions with the court, but the judge held firm that the ivermectin had to be given to this patient. That patient spent only about 5 more days in the hospital. She spent a month in rehab. She's 81 years old at this point. She's home and in full recovery. That made the Buffalo News and was the #1 news story for 5 days. From there, I got a number of calls and a number of emails. So the second one I've got was a woman in Rochester, 65-year-old woman in Rochester that was under the same kind of situation, only she had been on a ventilator for a longer period of time. I was able to get a second court order from Judge Frank Caruso to be able to get her the ivermectin. She improved as a result of the ivermectin, but then all of a sudden the hospital said they lost the ivermectin and they weren't able to get it. We had to go on the weekend to get a second court order from Judge Caruso, which we did. And she was finally given the ivermectin. That lady recovered from her COVID, went to rehab, and is now home and doing well. I had a third case of an 81-year-old gentleman who was in the hospital for 3 weeks, and the hospital totally refused to give the ivermectin. On Good Friday, this past Good Friday, I contacted the judge. This case, it was Judge Frederick Marshall, and he made me get the attorney for the hospital on the phone. She fought back, but Judge Marshall ordered the ivermectin. Given the studies that we've provided him, given the studies I got from the Frontline COVID Alliance, through this period of time, I met Betsy Ashton. She's a beautiful, compassionate individual who's been so helpful to me in terms of being able to produce the information I need. But we were successful again in that situation. And that gentleman is in rehab now on his way home. We have,
Ralph, how many total cases do you have, and how many have been already sort of won with court orders?
so we have had 5 successes. We have not had any failures. We have had cases where judges have postponed our ability to get in front of a court. We have had a situation in Chicago where I did get a court order, and yet the hospital refused to give the ivermectin in spite of the court order, but I was able to file a motion for contempt, and the hospital did provide the ivermectin, and that lady is now at 60% oxygen and 60% ventilator and 91% oxygen after 3 doses of ivermectin.
Well, Ralph, I just want to say your efforts, especially in this country, although unfortunately it's on an individual case basis, we're not doing systematic change, but I think that's part of what's going to happen. And it's been very satisfying for us to support your efforts. So thanks for that. And we'll come back and talk a little bit more about those cases. And then next we have Barn Ace. How did I do, Barn, with the introduction? I hope I did well. He's representing AfriForum and the efforts going on down there in South Africa. So Barn, again, similar to the other panelists, if you could just talk about yourself, introduce yourself, the organization, and what you've been fighting for, and what some of the challenges are that you've come across.
Thank you very much, Dr. Corey. If we can just jump into my slides. Of course, in South Africa, the story started with the use of veterinary ivermectin. So because we've got a large farming community, people started using the veterinary ivermectin, and that's how it started for us. So South Africa is a complex place, about 3 times the size of California, 11 official languages. Many languages are spoken, climate from arid to tropical, and we've got modern cities and rural villages, a really complex place to work in. Next slide, please. Now, due to the increasing failure of the South African government to deliver the most basic services, and also their failure to protect minority institutions, the solidarity movement was established as a network of self-help organizations to community members, and that basically enables them to take responsibility for their own future. Now, AfriForum, my organization, next slide, is a civil rights organization within this self-help network. We are a community-based organization that promotes the principle of community self-reliance. Now, there cannot be a balance of power between isolated individuals and the state or large corporations. So community-based institutions like AfriForum is positioned between citizens and the state, and they are critical for a healthy power balance between, in society. So AfriForum, currently we've got a membership of about 280,000 members, and they contribute monthly on a monthly basis. Now, we are not dependent on large donations, and this model of small donations from many members ensures sustainability, and it also prevents conflict of interest and undue influence. Last slide. So the South African Health and Products Regulatory Authority, or SAHPRA, this is now our FDA, they banned the use of ivermectin in December 2020, and then arrests followed in January at medical facilities and the confiscation of ivermectin. Then the authority made an about turn, and they said that they will consider access to ivermectin through the non-registered medicine Section 21 process. So a very courageous doctor, Dr. George Kutsia, submitted applications for use of ivermectin on 15 January. He did not even receive any response on his application. So on the 24th of January, Dr. George Kutsia and AfriForum approached the court on an urgent basis to get this applications approved. But before the matter then went to court, SAHPRA announced that they will be allowing compassionate access, and this was at the end of January. But of course, that was still very limiting because that Section 21 process takes a lot of time. And then some other groups also joined the fight, the Pharma Value Pharmacy Group, the I Can Make a Difference Doctors Group, the ACDP, the African Christian Democratic Party over here. They joined the fight. And then on 6 April, the court ordered off-label use of locally compounded ivermectin. So for us, the next big step is to get the Department of Health and SAPRA to change their recommendation on ivermectin to, of course, recommended for use of the treatment of COVID-19.
Well, thanks for that review. And it's really it's uplifting to hear the successes that Zimbabwe and South Africa has. It hasn't been easy, but you guys are making headway. So thank you for that. And then next, I wanted to introduce Congressman Mike Defensor from the Philippines. Congressman, I know you and I have worked together a little bit of some of your efforts. Could you tell us, what the situation is in the Philippines, what you've done, and where you guys are in the fight?
Yes, Dr. Corey, thank you for this, and to all the panelists. I just like to first say that the reason why I got involved is because I myself got sick with COVID, and I didn't know about ivermectin, but I was asked by my sister and my wife to drink it, and I felt better. But a week after that, there was a crackdown of ivermectin in the Philippines, and I'd like to just read a statement that I prepared, Dr. Corey.
Sure.
I'd like to thank the FLCCC for what it is doing for humanity, especially for the poor countries like the Philippines. I would especially like to thank you, Dr. Corey, for taking time in making a presentation to the Congress of the Philippines Committee on Health last March 30. Along with the concerned doctors of the Philippines, which is the local counterpart of the FLCC, Dr. Corey and our Philippine doctors made a great presentation on the scientific and medical aspect of the issue, as well as the experiences of those who have implemented an ivermectin distribution program in different parts of the globe. Unfortunately, the supposed experts advising our government did not attend, and what we confronted in that hearing are the Philippine health authorities and regulators. When we had that hearing, Dr. Corey, our death toll was at 13,000. Today, a month after, with no substantial change in policy, we now have 17,800 deaths. The Philippine situation is such that our doctors are prohibited to prescribe ivermectin to their patients, or legally, and it is legal, they run the risk of losing their licenses. No less than the Health Secretary, Secretary Duque, called up the Philippine Regulation Commission to complain about the 4 doctors who prescribed during an ivermectin distribution we organized a little less than a week ago. There are only 3 commercial compounding laboratories that are now allowed to produce in the Philippines. 2 are producing with limited capacity, and both were visited by the FDA as if they were producing illegal drugs. Manufacturers are not allowed to produce, even if ivermectin is listed in our drug formulary. To appease public clamor, the FDA Philippines gave 6 hospitals compassionate special permits, which we know can only be used in severe cases. They did not even announce the hospitals, so the public is unaware where to go to get treatment with ivermectin. Remdesivir, which the WHO recommended against its use, proliferate in our hospitals. The Philippines was part of the solidarity trial of the WHO, but when the recommendation against came out, they still continued it under a compassionate special permit and is given to all hospitals, unlike ivermectin, where it is only limited to 6. The surprising part is not just that. They sell remdesivir at a minimum of 400% the market prices, being sold from the sources which include India and Egypt, among others. The government announced that it will conduct a study which will be finished in 8 months. Until that time, we are limited in providing our people ivermectin. What is worse is that if you put the average deaths per month in the Philippines, we will have a minimum of 6,000 deaths by the time the studies are completed. If you go by 4,000, which we now have, you would have about 32,000 deaths with people not having access to ivermectin. The numbers are going down now because of the lockdown, but it will again rise once the lockdown is lifted. Only 342,000 or 0.3% have been fully vaccinated in the Philippines, and 1.7 million or 1.7% have been fully vaccinated. 0.3% are fully vaccinated, 0.3 are partly vaccinated. Today, the president recognized the doctors who are with us in the ivermectin distribution, and these are the CDC doctors, and stated that there must be strong basis for ivermectin for them to put their names and reputations on the line. Our FDA, Dr. Domingo, dismissed the observation of the president by saying there is still not enough evidences to prove the efficacy of ivermectin. In a survey conducted by the Philippine American Association of Scientists and Engineers, 533 doctors were surveyed, and the majority voted to allow the use of ivermectin for prevention and treatment. The DOH and FDA continues to make life hard for those who would want ivermectin accessed by our people. They mobilize the leaderships, not the memberships, only the leaderships of the Philippine Medical Association and the Philippine College of Physicians, among others, to attack the doctors who prescribed and called for the stop of ivermectin distribution. But we will fight, and we will not be silenced. Big Pharma can continue to have a hold on our health authorities and the leadership of our medical associations, but the people cannot be stopped. They listen, they talk, they read and watch, and they spread the news about ivermectin. Our health authorities have blood in their hands, and we will fight them in the massacre of our people. So I thank you, the FLCC, and all the panelists for continuing the fight. We fight locally, and we hold hands globally. Thank you so much.
Congressman, thank you for your comments. And yes, the whole thing is saddening, but I think I trust that you, like the other panelists in your efforts, are going to be an example to the rest of the world, and we're going to be able to turn this around. But this is really it's unreal what's happening. This resistance, or like Dr. Stone said, the antagonists. Let's state clearly a couple of things, right? So if we ask ourselves, what are the motivations for these public health organizations' behavior? It's not subtle, right? It's pretty clear what's going on, right? Is that there's a motivation to promote certain therapies over others, and those generally have massive financial interest. Even like you just pointed out, Congressman, the example of remdesivir, which was not found to be effective in the hospital, yet it's being given widely at great cost. And we're seeing around ivermectin, for instance, some of the leaders that you just mentioned, this constant dismissal of insufficient evidence when the evidence is overwhelming. It's becoming it's going to be a historical stain on the record of all of these entities that have done that, and they're engaging in what's called disinformation. Right? They're engaging in disinformation by trying to introduce doubt into the science behind ivermectin, and we cannot accept this anymore. And we should call it out for what we see. So it's clear, and even the WHO, unfortunately, a once great organization that has accomplished some of the greatest public health achievements in the world, in history, in the last 50 years, in the last 20, their budget and funding has changed. And now, unfortunately, they're completely under the influence of external interests, and many of them financial. And you can see it in the behavior of that unfortunate organization. And in ivermectin, again, it's one of the most egregious examples. So let me just ask briefly, and I'm going to come back because I think, Congressman, you talked a bit about where you are, what's happening in the Philippines. Dr. Stone, Mr. Ice did as well. I want to go back to Jean-Charles in a second, but before we go back to the specific cases, I want to ask you in turn, for instance, Mr. Ice, what are the consequences for public health if ivermectin continues to not be recommended?
Dr. Corey, of course, it will be devastating. Like I said, South Africa is a large place. We've got deep rural areas where you've got, well, basically no infrastructure. So even if you had vaccines to give, of course, it will be extremely difficult because, I mean, many places do not even have electricity. So there's no such a thing as a cold chain in existence. And of course, we know that it's really, ivermectin is easy to transport. It's easy to use correctly. You can keep it, if you keep it correctly, very simply in whatever temperature ranges you are experiencing on the outside. So unfortunately, we believe if we continue to block the use of ivermectin, we would lose many more citizens, and of course the most vulnerable people of society. So to us it will be devastating. Luckily, and this is in a way terrible to say, but luckily we've got veterinary grade ivermectin, and many people are now using the veterinary grade. And it's so sad, you know, that you have a medicine available that you can use, but people need to turn to an animal product to keep themselves healthy, or to get healthy again when they become sick. And I mean, I can now personally say that, you know, in a very close proximity to me, I know of lives saved with veterinary grade ivermectin.
And I agree. I mean, and you said it very well. I mean, clearly, we all know the consequences of the continued blockage and resistance to wide dissemination is many, many more lives. And beyond the lives, more transmission, more lockdowns, more collapse of economic systems. And I'm just glad that's why we're here today to talk about this. So I'm going to switch to some directed questions. So Jean-Charles, can you tell us, we have a question coming in, and I think this will help you also talk about what you're doing, where your court action is and what your approach is, but what can the public do in Europe to move the government to give in and provide the protocols for ivermectin? Or what are you doing? So what is your case and what is the basis for your case? And who is it against?
My action is in France, not in the Europe area, because the problem that I can see is that France and other countries has lost the power that they had before to decide. In France, by example, we have a lot of ivermectin. The molecule is very well supplied. There is no problem to have ivermectin because we have a lot of manufacturers in France. So this is not the problem. We have it. And it's not a problem also for prescription of ivermectin by doctors. I heard Ralph Lorigo and the cases that he has to defend. We have the same problem in France. It's not really the same. If you want to be treated by ivermectin, and if you are sick, and because you have the COVID, the medicine, if you ask it strongly, they will give you the ivermectin because it is very well known and very manufactured. So the problem is national guidelines,
right,
and lack of chance for people. And because the problem is not only 1% or 2% or 3%. It is a national problem, a European problem, and a worldwide problem. And to my level, I try to obtain a national guideline. And I can see that it is blocked. And it is very paradoxical because we have all evidences, as you know,
yes,
of course. And it is very difficult to understand because you have on the one hand remdesivir, who has an authorization, bamlanivimab,
yep,
who has an authorization, and it doesn't work. And it can be dangerous too. And on the other hand, you have generic, and they don't have authorization. and it works. So I try to convince French judges, highest administrative French judges, the courts,
Yes.
French courts. And we always had the same answer. This is medicine. This is science. I'm not competent as a judge to provide or to give you a recommendation. It's not my competence. There is health authorities for that. In this country, in Europe, there are agencies, medicine agencies. They are specialized in safety drugs, and they don't do it. So as a judge, I can do more than them, and that's the problem. I think that science has neutralized justice.
And so to summarize, and this is really unfortunate to hear, but there is, you know, the judges don't want to legislate on matters of what they think is science and medicine, which on the face of it sounds reasonable. The problem is, and I think I'll have Ralph talk about this, is that, you know, the judges here seem to be, and Ralph, maybe you could talk about what is the basis for the judge's decision to mandate ivermectin. I believe it's on the basis of equity, and they're trying to protect equal access to potentially life-saving medicines that are safe. You want to talk about that, Ralph? Why are you winning cases? What are the judges? What is the legal basis of these judges mandating the use of ivermectin?
So what we've been able to accomplish is this. What I look for is a local doctor that was willing to prescribe the ivermectin. And we give that local doctor as much information as possible. In my first case, he really didn't know much about ivermectin, but he was taken back by Judy's recovery in that 24, 48 hours. So he was willing to give me a prescription. The fight back from the hospital is that a judge can't prescribe medication.
Right.
That's true. Judge can't prescribe medication, but a judge can make the decision between a doctor who does prescribe the ivermectin based on everything I put in the affidavits, including all of the studies and all of the information I have. And I also put in the negative side effects, which are minimal. Right. And so we balance that. The judge has to balance that with the hospital saying, no, it's not FDA approved. Well, what about the NIH? So it's a balancing of that. And in every situation, I've been successful with the judges because it's a risk versus reward. In many of these situations, the hospital was out of bullets. They had done everything that they could do, and the patient isn't getting better. So I've been very fortunate with the judges that I've been across who have shown equity and who have determined that the prescription of ivermectin trumps the negativity of the hospital administration.
And so I appreciate that. It seems like on the individual cases, like you said, in these cases where it's risk benefit, the judges are willing to say the hospital's not offering anything else, but yet they're blocking a safe medicine. And to them, they're making almost a common sense, determination, which is the name of the organization, Jean-Charles, that you're involved with. So Jean-Charles, just to finish with you, is it fair to say then that your legal actions in France have been exhausted and they're not going to hear your cases anymore?
Not really, because we have my action to obtain a recommendation is over, is finished. But because we obtained the written engagement from authorities about freedom to prescribe, and I say, okay, it's good because if we have, it may be better than a bad recommendation,
right?
And, you know,
I agree.
And,
I agree.
Like hydroxychloroquine, remember what happened with hydroxychloroquine. So I think that maybe we can stop here for that, but I think this is a biggest problem, and I'm working about fraud, scientific fraud, and I filed a complaint, a criminal law complaint, and I asked a prosecutor to bring some investigation about some evidences that I can have because I'm in contact with a lot of people, even in England, and we would like the judge to investigate. And within 3 months, without an answer, I can bring the action before a judge, an investigating judge. You don't have this in the US because it is another system. In the US, you have an adversarial system. The parties are making investigation for herself. In France, the judge is investigated for the party at the proceeding. So this is different. So I think that we will have a French judge for further investigations.
Great. Well, all right. Well, I wish, obviously, we wish you the best of luck. I want to go back to Congressman Defensor. So, Congressman Defensor, there's a large contingent from the Philippines watching this this panel discussion, and one of the questions is, can the legislature mandate doctors in hospitals to give ivermectin if requested by patient or family?
Well, actually, Dr. Corey, we can do that. But the problem is the time for a policy to be approved. You know, even in the approval of laws, on average, I would think it would take about a year or a year and a half before any law can be approved. But the existing policy in the Philippines is that under our laws, if there is a public health declaration, then you can mobilize drugs that are not registered or are not approved in the Philippines, as long as it is approved elsewhere, or if it is in our drug formulary, it can be manufactured in the Philippines. What I'm saying is that, Dr. Corey, there is a way within the policy if the government wants it to be implemented. They're doing it for the vaccines. You have emergency use authorization for vaccines that have only been there or clinical trials for 6 months. You have ivermectin that have been existing for 40 years, part of our drug formulary in our essential list of medicines. And all they have to do is to allow the manufacturers to produce ivermectin, and people are willing to do it and sell it for a very small price. You know, it's less than $1 in the Philippines.
Very low cost. Very low cost.
Very low cost. So the poor in the Philippines can avail of ivermectin. To date, as we are talking, many hospitals have long lines of patients outside. They're staying already in tents. People who cannot afford, and even those who can afford, are staying outside of the hospitals because of the long lines of patients for COVID. So immediately, you know, you think, why is remdesivir being allowed, tocilizumab being allowed, and they give it immediately to patients, and yet ivermectin, which can be used as prevention for home care, not being allowed in the Philippines. So, you know, it's really big pharma influence.
And that's what we're trying to solve here on a global scale. And you know, Dr. Stone, I'm looking at, let me ask you a question, because I want you to talk about what you were just writing to us, but what can be done to help physicians who are either attacked or threatened with actions or revocation of their license? Can you tell us about your experience and how you've managed to really come up with a solution? It sounds like a little bit of a win-win situation that you were able to achieve. I think you're muted, Jackie.
Sorry about that. The interesting thing was that I was very publicly using ivermectin from the 8th of August. We were on a doctor's chat group. We were telling everybody what we were doing. We were posting success stories, and the 20 doctors that came on board all saw it working for themselves. And I mean, I can show you some slides that I prepared where we literally have a patient coming in at 79%, nebulized, given ivermectin, SATs go to 87%, 92%, 95% over 3 hours. It's dramatic. And seeing is believing. Our doctors, once they saw it, believed it. Okay.
But Dr. Stone, what happened to you? I mean, even after it
Yeah.
started to be used, what happened to you? And how did you make this a win-win? Because I think you got accused of improper behavior or something.
The reason I laughed at Michael's comment was I was taken in for questioning for dealing in illegal drugs. And I was taken to Harare Central Prison. And I was investigated by the narcotics squad for using a WHO essential Nobel-winning prize with a safety record second to none. Okay. Anyway, so the whole thing about it was I was taken in for questioning as the vaccines were coming into the country. And so the person behind my reporting, because I was reported by doctors, not by patients, and a group of doctors reported me to medical council, and the detention coincided exactly with vaccines arriving into the country. So one of the things that we managed to persuade, you know, this is not you can't argue this with science.
Right.
They're not interested in science. If they were, and they could read the data, this whole thing would be over. So it's clear that there is opposition. And the next question is who's creating that opposition, because the doctors are reading what is being fed to them. And I agree with your disinformation thing. So we sat back and we went, how do we make this win-win? We realized that under an EUA, if we show that ivermectin works, they have to take the vaccines back into trials. And with the billions and billions and billions of dollars that have been spent on them, we were going to lose. You are going to lose against Big Pharma. We're lucky in Zimbabwe, they're not interested in us because we're too small. Yeah, we are. And we also realized, so the Chinese influence in Zimbabwe is huge. They have always supported Zimbabwe, and they had a huge interest in us doing a lot of testing and in getting their vaccine into our country because we use Sinopharm. And so what we did is we went back and we said, well, if you don't want to escape the vaccine, the ideal thing to do is suppress it, is to suppress viral replication. And what do we know suppresses viral replication? And basically our protocol suppresses viral replication. And therefore, the virus will not mutate its way around the vaccine. And we live in a world where we have a lot of HIV. If there was an HIV vaccination and you were to give it in the presence of massive replication, you would just create mutants, you would create superviruses. In the same way, if you were to give monotherapy in end-stage HIV disease with high amounts of viral replication, you would be creating resistance.
Sure.
And our Ministry of Health understand that because we know from HIV, when we hit it hard and we hit it early and we hit it with 3 drugs, it went away. When you try and treat an end-stage patient with AZT, all you get is resistance. So we managed to get the message across that ivermectin was in fact perfect to make Sinopharm work.
So you're telling me that common sense and good rational scientific argument seems to have made like a win, a W in the win column in Zimbabwe?
Well, the win is because ivermectin supports vaccination, and that's what they want.
I like it. Well, I think that also could be a model, and I think that argument maybe should be borrowed and taken in some other areas especially amongst our panelists. So here's a question. Trying to figure out who I want to ask this to, but maybe Barent, can you tell me, can your organization or another take the WHO to the International Court of Justice in The Hague?
Dr. Corey, we had discussions with people from other countries about this exact question, and we also approached an international lawyer. And what the lawyer indicated to us is that with law, it always works from local level upwards. So what they basically told us is that it's really difficult for you to, let's go straight to the WHO. That was actually the plan, because of course, we all know if you would get a recommendation from WHO, we all know that it would work like a waterfall, and that recommendation would sort of run down into other countries, and that would solve most of our problems. Because in South Africa, doctors are not prescribing off-label because there's some insurance issues if you prescribe off-label stuff. That's one of the challenges. And of course, once government recommends it, you remove that insurance issues, okay? But our legal expert told us that you will have to litigate from the bottom up. So you will basically have to litigate in your own country up to the highest court. Now, I mean, in our country, if you would litigate up to the highest court, that is years. Usually, that will take you some years. I mean, if you get very special treatment, you might end up doing that in months. So I believe the correct approach is the bottoms-up approach. Tackle it well, actually at the most local level you can. If possible, of course, take it up to national level. But I believe to do something or to have an action against the WHO, we will have to have something like a few governments of a few states actually deciding to do something together and approach the WHO. Because as one state at a time or a country at a time, I think your chances of having success will be really limited. You will have to sort of have a consortium of states after litigation in their own countries, or possibly governments. Wouldn't it be great if we get a few governments that say, listen, as governments, we will now approach the WHO to correct this. So that is our understanding of the matter of tackling the WHO.
And I'm going to just ask a general question. Maybe one of you can answer. It's a question coming in. I don't know how easy it is to answer, but where do you think where do you think people worldwide can find doctors who are willing to prescribe ivermectin? Jean-Charles, I mean, you're saying that in France, obviously there's no restriction, but it's also not in the guidelines. It's not being recommended. I'm finding, in my experience, is that a large majority of doctors are either too tired, too busy, and they're not actually independently assessing the evidence. So, I'm not going to say it in a judgmental way, but lack of knowledge around ivermectin is profound and widespread. And that's something that could be solved, obviously, by national health ministries. They could lead in this area. But absent that leadership, we are seeing doctors individually on the ground. For instance, I'll talk about in the United States, we have what are called telehealth providers. And on our website of our organization, we've just listed those that do routinely prescribe ivermectin. Is there any such similar way of finding? So Jackie, I'm not even going to ask you, because you're saying that everybody's using ivermectin in Zimbabwe. Mike, Congressman, you've already kind of said that I think once it starts to be compounded widely, I think the doctors will be freer to do it. How do you find a doctor right now to prescribe ivermectin in the Philippines?
Yeah, Dr. Corey, the situation right now is that, the event that we had for the distribution, the doctors were threatened that their licenses will be revoked. And so most of the doctors in the Philippines are afraid to do a prescription. Now, the production of, not like in the US or Canada where you have compounding laboratories all over, in the Philippines, it's only in Manila. And these are like in one compounding laboratory, they can only produce 1,000 tablets a day, which is about, if you give 10 each, it's about 100 families.
Right.
So yeah, it's actually, they're really killing the supply of ivermectin in the market. And that is the situation that we're faced with now in the Philippines. And it will continue. So now what you have here is many people getting it illegally. Some manufacturers are quietly producing. But the other day, I was just talking to a general who was in charge in looking into the ivermectin distribution, and he was telling me, Congressman, just stick to the guidelines that it has to be compounding and there should be prescription. But can you imagine, Dr. Corey, the limitation we have? We want to give it to as many people as we can. We want to talk about it. We want to educate people, but the authorities are the ones limiting us. And that is
Yeah.
actually the situation now. You've been talking to our doctors, and I know that you know the situation.
Yeah, no, and so it seems like in different places the barriers they use different ways to block the dissemination of ivermectin. And it's clear that this is about opposition. We're beyond the science, and I've been saying for weeks I no longer want to lecture about the evidence supporting ivermectin because it's already proven. We know it's effective. And now I'm finding myself having to get involved in things like this, was trying to figure out why is the science being blocked. It's not about the science anymore. And so, Dr. Stone, let me just ask you, and the answer is going to be straightforward, but can you like articulate for us who is being hurt around the world by the World Health Organization's non-recommendation of ivermectin?
I personally think it's both patients and doctors.
Yep.
You know, for as far as our patients go, and to give you another idea of how we manage this, we did not get this through at doctor level. In the early days, we circulated exactly how to use ivermectin on WhatsApp. And Zimbabwe operates on WhatsApp. The Bush Telegraph takes an hour to get around the country because everybody shares it on groups. And so we put the protocol down and we use zinc, ivermectin, and doxycycline together because it's a zinc ionophore. And because doxy is a zinc ionophore, that's the way that we see it best. We also know that we cannot afford for resistance to ivermectin to develop. And that's also why we use triple therapy. We're not even prepared to entertain the risk. So those protocols were circulated. They were based on Tom Barodi's protocols from Melbourne. And the whole country knew exactly how to use it. Now, one of the things that happens in Zimbabwe is that most people have a friendly pharmacist. And friendly pharmacists who, especially those who care about the patients that they serve, are willing to dispense. Now, malaria is virtually a pharmacy issued, doxycycline is virtually a pharmacy issued medication, which means a pharmacist can give it over the counter without penalty, particularly if they think a patient has malaria. And so it's widely available. Most people have doxy around because it treats malaria and bacterial infections. Zinc was widely available. And going back to what Byron said, you know, ivermectin in its liquid form is lipophilic. It reaches double the levels that it does if you swallow it, and it can be applied transdermally. And we basically put out to the populace who circulated it widely and saw it working exactly how to treat themselves. And that actually is what worked here. There are so many doctors who oppose it. I've just been to Matari, which is on the border with Mozambique, and had a discussion with somebody who runs an old age home there. And the doctors refused to give ivermectin. They had 6 patients dying of, well, 6 patients did die in frail care from COVID. I got the phone call as to what to do, sent the protocol, and the guy who ran the old age home literally passed liquid ivermectin in bottles over the fence. And they applied it transdermally because people refused to allow it to be given. People were going in with ivermectin in Johnson's baby oil bottles and rubbing it into the patients. And from that day, every single patient survived. I shudder to think the dose that they gave, but whatever they gave, it sure as hell worked. And, you know, there is that resistance, but we've had to drive it at patient level. The patients have driven this. The doctors, the regulators, the opposition. I've just been on a group and I've literally been threatened on that group to be removed from it if I mention ivermectin again. It's the research group of the country.
Let me ask a question. Since we have lawyers, I'm going to ask Ralph. Could you answer the question? What'll happen? What type of what can happen? Can colleges and other organizations be held responsible for vaccine-related illness if they force people to get vaccinated? Is that a legal a case that can be brought? There's a question from the audience.
Well, I don't know that they force people to be vaccinated. What I've had questions from people that call me and say that in order to return to work, they need to be vaccinated. That gives them an option. I've talked to some labor law lawyers with regard to that issue, And at this point in time, there is no clear answer to that. It would have to be litigated, and it would have to be whether or not you're violating a person's constitutional rights to go back to work.
Yeah. To answer to the precedent prior question concerning what I can observe is that in France, the doctors, they only listen what are the national guidelines. And I think that this is true in a lot of countries in the world. Because if doctors would not listen and the information from the authorities, from the regulators, if doctors, if there was a little bit courageous, brave, they maybe the pandemic will be over right now with ivermectin, and this is the point is that maybe doctors doesn't read studies, and maybe they can do that. Maybe they don't know that, and it's a big problem. It's maybe more there is, to me, fraud and corruption by industry. But there is not only that, there is a psychological explication, a problem too, and of education, even from the doctors themselves. And I think that it is a very profound problem.
Yeah. Jean-Charles, okay, go ahead, please.
Pierre, I think that one of the big challenges here is that you are sitting with isolated individuals that need to fight. So I think one thing that we really need to understand globally is you have to organize people into community-based organizations, okay? Because community-based organizations with a large membership support can actually support something like a big case to fight big cases. And of course, if you've got lots of members contributing each one a small amount of money, you are not vulnerable for a big donation or a big donor to withdraw funding, and that can stop you. So in my mind, the key solution that we will need in every country is that you cannot be in a society where you only have a single isolated individual or a group of isolated individuals and big corporations and a big state. You must organize community members into community institutions so that they can be balanced in the social power structure within a country.
And I think what you said is so important. And, everyone on this call is part of or representing an organization. And I think, obviously Afrofarm is much more mature in fighting for things like human rights. And I love the funding model that you have. And I think that is a model for an effective, social organization. Congressman, can you tell us about your organization and what it's doing, outside of government? Obviously, you're a congressman, but the organization that you're also affiliated with, how are they overcoming the resistance? What are their actions?
Well, Dr. Corey, in the coming week, I've been discussing with them about filing a legal case in court. Number one, to allow doctors to prescribe. And number two, to petition the courts to allow not only compounding, but manufacturing of drugs. We are in a public health emergency.
Yes.
This is war. And, we cannot just say limit it here, do not stop here. These are the guidelines. If we see that this ivermectin can help people, then we can allow manufacturers to produce because they're willing to produce ivermectin. Number two case is that we will file against the health authorities on two grounds. One, a civil case for those who have paid so much for remdesivir. And number two, a graft and corruption case for the health authorities to allow remdesivir and other unproven drugs, very expensive drugs, to be paid not only by the government, because we're using government funds, but also by private individuals. So this is the two legal paths that we have discussed. And beyond that, we're continuously going through our distribution process. We're giving it to as much people as we can. and we're containing it in certain areas so that we have a study also of what the outcomes of those who want it for prevention and for cure. We hope that by doing it in one city or maybe several cities, that the results would be used now by the national government so that other provinces and cities will be allowed to use it as a campaign. You know, sometimes, Dr. Corey, I'm already tempted to do a deworming campaign, not a COVID campaign, but a deworming campaign so that legally we'll be able to have this mass distributed to our people.
Congressman, do you know that there's a governor in Paraguay who did that with remarkable success? It's Alto Parana, which is a state in Paraguay. The governor and his brother got sick. They felt immediately better with ivermectin. He was very impressed. And to go against the federal health ministry, he established in his state a deworming campaign where they distributed ivermectin widely, and they emptied the hospitals in 6 weeks. Emptied the hospitals.
Yes, I'm thinking of that, and I think it was also done in Chiapas, Mexico.
Yes.
Yes, and
and the other thing that you said, which you know, I've been saying for months, is that, but it's not heard. But you know, the fact that we're at war and they're putting up these peacetime regulations, that's not how war works. You don't follow rules meant for peacetime when you're at war, and I think it's really troubling that this is happening. It's just completely insupportable. And the last thing I want to also say is that, because you mentioned, and we all keep talking about guidelines as if the guidelines are how we're going to win this. Another appeal I want to make to really the physicians of the world, that, for instance, if you look at our own National Institutes of Health, the United States, their guidelines clearly state that they are not mandates. They are guidelines. Physicians do not have to follow the guidelines. They invite you in a shared decision-making model to use your expertise, your ability, and your understanding of the evidence, and you are allowed and still have autonomy as a provider, as a physician around the world. And the problem is, I think many physicians don't see those guidelines as guidelines. They do see them as mandates, and they're very fearful of straying from them. And that's not what those documents are for. They're general guidelines. And I think there's a role for physicians and physicians groups to recognize that and take back some of this autonomy. I'm sorry, did I miss any other comments? Yeah.
No, Dr. Corey, I heard you speak in the Senate, and you were talking about the Afro-Americans and the Mexicans are the ones being affected, the marginalized sectors.
Yeah. And elderly, yes.
The elderly. In the Philippines, it is the poorest of the poor. These people cannot even buy vitamins. And, you know, it's hard for them, you know, just to follow the FLCCC protocols of what to drink. And now, you know, you stop the use of ivermectin for them to save themselves and to save their family members.
Yeah. Now, quick question. Maybe you can answer this, Jean-Charles. We're getting a question from the Netherlands. Can doctors and lawyers there join with Bon Sens from? Actually, it is. It's a multinational European organization, correct?
You talk about Bon Sens?
Yeah. Yes.
But Bon Sens it's only a citizen, but there is a lot of scientists and some doctors too, and some experts.
But not just France, though, Jean-Charles. So Netherlands could join?
Who? Sorry?
Holland, Netherlands, other countries besides France?
No.
It's just French.
That's just French, yes.
Okay.
Yes.
All right. That was a question. Did I miss any other comments that anyone wanted to add, Jackie?
Yeah, one thing I did want to say is I would actually encourage physicians to stand up to the regulators, because clearly I went in for a disciplinary hearing, and my lawyers were fantastic, but I walked in and there was no question that I was going to be struck off. It was what my lawyers called a trial by ambush. Okay. They called for a postponement. One of the panelists actually said, if we postpone, will that alter the verdict? Which means judgment was passed before I'd even gone in. Standard operating procedures, if I hadn't had the legal team and the support that I'd had, I would have just panicked when I was served disciplinary action. And instead, my lawyers and a very good friend of mine went through the entire, everything that they did piece by piece, and pointed out every failure to follow standard operating procedures. And in fact, I don't think they did follow a standard operating procedure. They then said that those were guidelines, not, they cherry picked what standard operating procedures they wanted to use. And at the end of it, my legal team walked out. They advised me to not plead because I then validated the procedure. Because even if I pleaded innocent, I would have validated the procedure. So I refused to plead. They then refused to defend me because I have a right to have legal defense. And they said they couldn't defend me because the verdict was already made. So how do you defend somebody who's already been prosecuted? And we then went back, and it was clear that we had the ability to sue the regulator.
So what is your recommendations for doctors, Dr. Stowe? You started out by saying that you have guidance for physicians.
So if I was to recommend to doctors elsewhere in the world who actually feel passionate about ivermectin and want to save lives, let the regulator threaten to strike you off. Go in with all your data. They said, you have been prescribing ivermectin, which is a dangerous drug. I said, really? There's a 42-page document that proves its safety, and you are recommending vaccination, which is, there's absolutely no data on. And if the vaccination, if the risk outweighs the benefit in terms of vaccinating against COVID, here's the data that shows that ivermectin is 50 times safer at the current rates than vaccination. So how can you tell me that it's not safe? And I went in to the hearing with the facts.
Yes.
And they could not argue against it.
So,
and you stand up for what is right when you are disciplined.
So this is my take on that. And I've long been saying that I have no worries about being brought to, let's say, a legal action, because I have the science and data on my side. The one challenge is none of us really want to go into a courtroom. We just want to be at the bedside caring for our patients. And so, you know, I feel safe because I know not the truth and data always win out, but I believe my actions and all of my colleagues' actions, and around the world, there's enough data to support the use of ivermectin. But again, we want to avoid those legal interventions. So I just want to sort of finish by thanking everyone for coming. And I want to call out that we are having successes, right? There is hope. I don't want to use the term winning, but we are progressing here. We're getting more ivermectin to more people around the world. The knowledge around ivermectin is increasing. And you know, I think like Baron said, I think the answer and the call to action is for all citizens, probably the most effective way to continue this fight to improve the global public health, which is being blocked, right? We know that this is up against significant interest from the other side. But it's really to seek out like-minded civic, social organizations in your countries in order to really bring enough force and enough numbers to try to fight against these very deep-pocketed and very large entities that are resisting this. And so I think everyone on this call has given an example for what we're doing in that fight. And I think the organizations vary around the world, but it's time for those organizations to step up and lead. And I think their membership also has to increase. They have to become more formidable with louder voices. And so I'm going to finish there. And again, thank you all for coming. And I think we'll all continue the fight. And you please all share any latest successes, challenges, ways in which you've been able to overcome a new form of resistance. And we will try to disseminate that knowledge. So I just want to thank everyone for coming. I also want to just say to the audience or people watching that the video of this panel discussion will be available on our website, which is FLCCC.net. So you can share the links later, and this can be watched and reviewed. You know, I'm just so happy to find like-minded warriors on the path here. It's just sad that we have to fight this fight because it's so, you know, public health is, I cannot think of more damage to public health, an example which is more damaging in one swoop, which is this active resistance to a low-cost drug, which could help the poor, the impoverished, many health systems where, like Baron, you even said, in areas without electricity. I mean, this would be a highly effective medicine that's being prevented. And so let's just keep fighting for common sense, and science, really. And so thank you all for coming.
You're welcome.
Thank you very much,
much.
Pierre.
Thanks,
Okay.
Pierre.
Thank you. Okay. Bye, guys.